Namaskar. Welcome to This Week with Padma Shri Dr. Sudhir Parikh. Dr. Sahab, welcome. Namaste.
Namaskar.
Dr. Sahab, how do you see the rise or sort of a second wave of COVID-19? Do you think it was avoidable, or because of the variant that we are hearing, it was bound to happen?
Well, it was avoidable, but unfortunately, people, because of whatever reason, because of the fatigue, because of the political gathering, because of the religious gathering, and people are not following the strict COVID guideline. I think this wave started, and this wave probably has a variant of the when any infection, in any viral infection, it goes on in the community for a longer time, it mutates. It means it changes the virus changes its character, and that character most of the time is highly infectious. It spreads very fast, and that's what happened in India right now.
And Dr. Sahab, just a few weeks ago, we were looking at India as from the point of view of vaccine mastery, and India also exported vaccine to several nations in the world, extended the helping hand. Now, with this mutant or the variant that you just mentioned, will this vaccine be able to overcome the potential threat by this variant, or we will have to come up with another vaccine? As a physician,
No,
what?
no, this vaccine is as effective as anything else, and there is this vaccine. But only thing is, vaccine has to be given to all the age group, because this variant is very kind of if affecting the young populations, and therefore it should be given to everyone in order to break the chain of the this surge. And I'm sure Prime Minister is already announced that everyone above 18 years of age, they will be eligible for the vaccine, and he promised everyone that vaccine will be available in plenty, and there should not be any shortage of the supply.
So, in this context, I jump to the latest policy directives that are coming from central government for state governments, and one criticism has come that government is also allowing private professionals or private hospitals to sort of buy and administer vaccine. Do you think the policy that some people get it for free, some people pay it, is likely to result in some sort of a confusion? And should government have taken over the responsibility for vaccinating everyone? How do you look at it?
No, I mean, ideally, government should take the responsibility just like what they are doing in the USA. But unfortunately, the surge is so powerful. Every day, there are 2 lakhs of new infections are happening. The hospitals are completely full, and whole healthcare system is collapsed right now. And people are kind of. I just now this morning I was talking to someone in the Gujarat, and they are saying that people are having oxygen in the auto rickshaw, or and they have to wait 10 hours to get even cylinder of the oxygen, one who is not breathing right. So that this all kind of very grim situation. So I think vaccine by anyone, whether it's a government or private institute, can afford to give a vaccine, should give, because actually price of vaccine is not that high. It's only 300 rupees for 2 dosage. So I'm sure middle class and upper middle class or even lower middle class can afford that. Only poor people cannot afford it. But I think this is the only way to ramp up the number of vaccination, because once we do the vaccination up to 70-80% of the population, then the whole pandemic will go away.
So, Dr. Shah, earlier there were different theories, and these are unscientific theories, that immune system of Indians, because of the living conditions, is different than what it is here in America, and that potentially was looked at the reason for low number of deaths in India. But looks like that theory is not holding true anymore. We
No,
are
because we don't know how the dates are counted or dates are labeled. So, but rather than going into that kind of discussion, right now the problem at hand is very serious, very grim, and very one has to get vaccinated. Most of the population, one has to stop gathering of political, social, or otherwise, and one has to make sure that healthcare system can stand up and survive against this kind of infection. They should create the new hospital, kind of temporary hospitals, and there should be enough oxygen supply, because in this disease, when the infection happens, and those who cannot breathe properly, or whose lungs are affected, those people, if they don't get oxygen, even they get oxygen, they usually end up having a terminal result. It means they die. So right now there is a serious problem, and therefore hopefully the hospitals are there, enough oxygens are there. Government has to make sure that all the auto companies should start making extra ventilators and all those things. But time is too short, and time is only few weeks here, and therefore there is no room for politicking or doing kind of who is right, who is wrong. Just let's work together and attack this problem.
So what you are saying is quite logical and it makes a lot of sense. And when you look at it from a distance, then it's even more easier probably to see how the whole picture is emerging. But looking at the ground situation in India, exactly opposite to what you said. Politics is again surfacing from opposition as well as from those who are in the ruling situation, whether it is state governments or central governments. And one hears every day, whether it is Delhi government or Bengal, Rajasthan, Maharashtra also probably, with more criticism of center for not providing oxygen and indeed the lack of
It-
hospital beds here.
It's not criticism; it is reality.
Right.
Yesterday, I was listening to chief of the AIMS and chief of the COVID task force of the central government. He's saying, and a couple of other doctors were saying that even a hospital like Jaslok Hospital or Apollo Hospital, they do not have enough beds, they do not have enough ventilator, and they do not have enough oxygen supply. And so that is not criticism by anybody to anyone, but it is reality. And we have to forget about the politics. We have to forget about who is right and wrong, as I say. And government has to make sure that all the industrial oxygen should be diverted for healthcare system to take care of patient, because health is the first and manufacturing is second.
Indeed, so manufacturing is also being pumped up for vaccines so that more people can get it. Looking at the approach with which some experts or some politicians work towards curbing it and preventing more unfortunate people leaving us, one approach which we have seen is lockdown was considered an important step in stopping it. But in the second phase, what one hears from Prime Minister is that he is suggesting lockdown to be treated as the last resort. Why this shift? What do you think is the reasoning behind it?
Well, I'm not sure, but he's right in a way that lockdown has to be considered very seriously and has to be last resort. I agree with him that way. But right now, the situation is so grim that lockdown is probably imminent in near future, and therefore, I think if there will be if we delay too long, then I think whole thing can go out of control.
So, with calm and patience and collective will, one can face all the challenges, including COVID-19. but that spirit is needed. And looking at the ground realities, we have had months of farmers' agitation. So, leaving aside the cause, but the fact that during COVID, so many people were together on the streets, same way as you mentioned earlier, election rallies, and uh, this migration of labors, we may again see another development in that direction. So, what measures at this point government should take also involves Prime Minister's suggestion that youth should form a committee and work with COVID administration. Do you see that as one practical step in the right direction?
No, I mean, it is a good idea. It is a good idea, but I think government has to all the state government and central government has to be really take everything in charge and stop all this Kumbh Mela and any other religious, because the Kumbh Mela is a big super spreader here, because this many people and as Prime Minister said that it should be a symbolic now. It means that they should stop after 2 weeks of Kumbh Mela and disperse. Everybody should disperse from there. And I think some of the leaders are agree with Prime Minister and some are not, and that's very unfortunate thing. And the same thing applies to most of the other social, political, and religious gathering. And also, people should also get vaccinated, because unless you get vaccinated, even small group gathering can create more havoc. So and but more than that, I think government's responsibility now to make sure there is enough oxygen supply, there's enough hospital bed, and there is enough doctors and nurses who can take care of patients. There is nothing to, everybody should keep their ego aside or criticism aside and work together.
I think you made a very good point, and in the same way, there are reports that the number of people gathering to observe Ramadan, that also is being addressed, and many leaders at the Kumbh Mela have agreed to Prime Minister's call. He also talked personally to some of them, and so we hope good sense prevail, and what needs to be done is done. Being NRI and looking at this situation from USA, being active with many organizations, including RP, etc., do you see any role at this point of the physicians who are from Indian origin and away from India, if they can do something?
Well, they can only talk to their relatives and friends and make sure and convince them to go ahead and get the vaccine done. Do not hesitate to get the vaccine, because we have so many rumors and so many wrong social media posting that vaccine has problem, vaccine is not good, blah blah blah, and then we being uh, some people are very superstitious too. So all those things we can explain. Other than that, doctors or anybody from here, not much can help really, other than supplying more vaccination. Let other vaccine like Moderna and Pfizer can go to the India, and Indian government should ramp up the whole thing and get vaccinated. And you convince everyone wherever you get a chance that vaccine is safe, it is must, and one must get it.
Absolutely. And as we move towards the concluding part of our conversation, I bring to your attention again Prime Minister Narendra Modi's statement that second wave of COVID has hit like a storm. Also, somewhere is an admission that they could not foresee that it could escalate to this extent. And I think the system is not prepared, and neither it was here in America. So that needs to be done on war footing, which I hope is being taken sincerely. And as we conclude, your take on the suggestion by Bengal Chief Minister that the rest of the three-phase polling in Bengal should be combined, and maybe it can be done away in one way or something. Do you see that as a practical approach and whatever way election commission responds to it?
I think because of the COVID and because of the all the party, including BJP and TMC, they all decided to not to hold a rally more than 500 people anymore going forward for last 10 days. So I think it's not bad idea to have all the poll club together. That way there is a less exposure or less crowding, less get together, and that may help because in even Bengal also the cases are rising. Yesterday it was almost 8,000 new cases per day, and that is not good sign, and therefore and we may hear even worse than that, because usually it takes 2 weeks after all this gathering happens. So I think it's not a bad idea to club together last three phase and get the election done even sooner than later.
Absolutely. And I think election commission would consider the practical side of making it happen, and hopefully things will move in the right direction. And your parting words for our viewers from this edition, Dr. Parikh.
Yes, what I would like to tell my all Indian American friends to call their relatives, friends back home, explain to them what is important guidelines for COVID, tell them to follow that, do not take it lightly, and most important that please get vaccinated. If you can afford to pay 300 rupees, go and get vaccinated privately. But sooner you vaccinated, better you will be. So please do that, and hope everything works out well. And we pray God that India, this COVID situation in India, should curtail sooner than later. And thank you very much. Thank you for joining me this week. We'll see you next week. Till then, goodbye. God bless America. God bless India. God bless Indian American community. And thank you very much.